Another potential clinical area for the use of ultrasound is for joints. So before we just look at what research we have and consider how we could use ultrasound for joints, I'd like to just have a look, just recap on joint disease and have a think about what we would actually want to do. So let's take this from a different angle. Let's come in from, rather than here's ultrasound, here's what it can do, let's have a look at what happens in the joint and the structures that we have there, and have a think about what we could possibly target, and why we would want to target that. So this is just an image of a regular synovial joint. And so let's have a think about the structures that we have. Now, the synovial membrane is a key area that we would want to target. And it's a fibrous structure, a connective tissue type structure. So it would, it's collagenous, it would absorb ultrasound well. You can see that it's, well, on this image, it's relatively close to the surface, but on most joints, it is relatively close to the surface, which means we can get it with ultrasound. Obviously, if we're looking at, horses and larger animals, then this is more difficult to target. So if we're looking at facet joints in the spine or the sacroiliac joint, you're not going to get there with ultrasound. But when we're looking at the smaller joints, so anything sort of, even you can even use ultrasound around the bulbs of the heel to focus into the hoof and potentially get the navicular joint, and then all the joints, the carpus, moving up the hock, the stifle, even you can attack on a horse with ultrasound. But with the small animals, obviously they're, especially if they don't have much fat covering, most of their joints are potentially really close to the surface. And within that joint, the synovial membrane, which would be an area of target, is very close to the outside of the joint. So why would we want to target the synovial membrane? Well, synovitis is common in many osteoarthritic cases. So any cases of joint pain or degenerative disease, there's normally an involvement with the synovial membrane, and the synovial membrane itself becomes inflamed, and that releases chemical mediators into the joint, pro-inflammatory chemicals into the joint, and can contribute to this downward cycle. So if we get debris into the joint or parts of articular cartilage, debris into the joint, this irritates the synovial membrane, which becomes inflamed, and the inflammatory response then is exacerbated, and it's and then that inflammatory response makes some changes within the synovial fluid, and that then further degenerates the joint, and it goes on and on and on in a cycle. So if we can potentially break that cycle by mediating or modulating that inflammation within that synovial membrane, which ultrasound is able to do, then we can potentially break that cycle and help to modulate that inflammation within the joint. So the synovial membrane is really a target for us, and the synovial membrane lies just on the inside of the fibrous joint capsule. So that's potentially another area for target. And let's have a think. What would we want to do with the joint capsule? Well, in an osteoarthritic situation, the joint capsule will contract and thicken, and this is in attempt to stabilize that joint. And in fact, what we need to do, which we'll look at in a moment, what we need to do to help that fibrous capsule sort of long term is to strengthen the muscles around the joint, reactivate those, and then that takes some pressure off the joint capsule, and it can adapt back to being less thick and less sort of restricted. But that's a bit more of a longer term option. But with using ultrasound, we can target the joint capsule. We can provide some heating, and a potential use for ultrasound with the joint capsule. A theory behind it would be to increase some heat into that tissue, whether it's heat that makes the difference or whether it's a non-thermal effects. Anyway, regardless of that, provide some ultrasound to the tissue and then have some movement after that, and we'll look about tissue extensibility in a moment. But that's another potential target for the joint capsule, and it is very close to the surface. Now, when we look at articular cartilage or the subchondral bone, which both are affected obviously by an osteoarthritic or any sort of arthritic condition, when we discussed about ultrasound absorption into tissues and the fact that it likes dense collagenous tissues, you might be thinking, well, then hang on a minute, these are the most dense tissues of that form. Surely ultrasound's going to be gobbled up into those structures. But unfortunately, because of the makeup and because of the situation with ultrasound, a large amount of the ultrasound is reflected off the surface of articular cartilage and bone. So although if it could get into there, it would do the same things and be very good, it can't get in because it just bounces off. And that's where low intensity pulse ultrasound comes in. So we'll park that for now, but we'll think about that again in the low intensity pulsed ultrasound lesson. So unfortunately, there's not a lot that can be done with either shortwave or long wave ultrasound as far as articular cartilage and bone is concerned. Although if we improve this local environment, the synovial fluid, if we can modulate the inflammatory mediators within that, bring that down into a less sort of aggravating environment, that's going to obviously have a knock-on effect to help to calm the whole situation down. The other thing that the synovial membrane is responsible for is the synovial fluid and the viscosity of that. So when we have nice viscous fluid, it's a good lubricant to the joint. And in osteoarthritis, you see reduced viscosity of that fluid. So you can compare it maybe to, a healthy fluid would be more like an oil, and an unhealthy fluid would be more like a water. And you also then get joint effusion. So again, by targeting the synovial membrane and helping it to behave how it should, we can influence that synovial fluid as well. The final thing then, the ligaments. So we have obviously ligaments around the joint and periarticular muscles as well. But obviously the muscles we're not going to necessarily directly target with ultrasound, but there is a bit of a knock-on effect, which I'll discuss in a moment, to the periarticular muscles. And obviously they do have tendinous insertions, and we have the ligaments around the joints, all of which are fibrous tissues and can be targeted with ultrasound. So there's a lot that can be done with ultrasound. It's not really working to repair, the root of this problem, which is obviously the articular cartilage, the subchondral bone breakdown and osteophytes, etc. But we can certainly do a lot to modulate the situation and help to improve it. So let's just have a look at what sort of we're talking about when we think about research. All the research is in humans. We don't have anything significant in animals with ultrasound and osteoarthritis. There are over 100 papers on this. Most of them are positive. There are some reviews that don't support ultrasound, but the way they've actually been done, you could argue, is not very fair. Many of the studies will use ultrasound alongside something else, so exercise and ultrasound, or ultrasound and electrostimulation, and then it's very hard then to tease out what made the difference. And so sometimes these reviews will say, well, ultrasound is not supported over something else. Well, the patient's improved, so whatever improved it was good. So there's a little bit of discrepancy with that. But generally, there's positive. The body of the literature out there is positive towards the effects of therapeutic ultrasound on pain and function in people with osteoarthritis. There are two papers here that one will just be a link to an abstract. This paper on the left, I'll pop into the vault for you if you want to read that, or just whiz through it. These two papers use slightly different dosage, being pulsed, one being continuous. But they both had positive effects, and these are quite recent studies, so I've just pulled these two out. They both had positive effects, but what sort of comes through in the literature is that the long-term follow-up, whenever there is a long-term follow-up, both of these studies were done over a short period of time, and then, the longer term, there's short-term improvements, but when you look longer term, they're not continued. So that's something that we need to think about. So it seems really that treatment with ultrasound for osteoarthritis will have beneficial effects, will have immediate improvement in pain and function, quality of life. But if you then stop that treatment, it doesn't necessarily continue, although I have, theories about how we can get that carryover, and that's more to do with exercise. But both these studies really show that you can have a very good response with pain and function, improvement in pain and function. But we need to think about how we carry that over long term. What was interesting, now I'm looking at this screen, I can't remember whether this was both of these studies or just one of them, but a very interesting point, and has been shown in other studies as well, is that there's an increase in muscle mass over a period of time. I think one of these studies was over 4 weeks, or had a 2-week treatment, but then it was assessed again in 4 weeks, and the muscle mass improved. And when you have osteoarthritis, there's becomes a situation where you get muscle atrophy alongside that, and the authors discussed the fact that by using ultrasound, their theory, all their conclusions in their discussion were that by using ultrasound to reduce the pain, then the function improved and therefore the muscle mass improved. And this is really quite a key thing, because if we can improve muscle mass around an osteoarthritic joint, or we can improve muscle strength and neuromuscular control, we can do a lot to help with osteoarthritis. So if we can use ultrasound for no matter what it does, whether it's pain relief, whether we've got those histological changes, or whether it's all of that put together, if we can use that to not increase muscle mass itself, but improve the environment or the situation so that muscle mass will increase, then that's got to be a really good theory for us to use that to try and kickstart our patients into using their cells again. Especially with animals, we can't really tell them, I know it hurts, but you need to do this. Whereas if we can use something like this to help, then that's a really sort of strong underlying rationale for using therapeutic ultrasound for osteoarthritis. There is one, this study is with dogs, so I put it in, but it's really not a great quality study. It's not even listed in PubMed, this one, but it has been referenced in some of the veterinary literature that I've read around this. So some of the veterinary physiotherapy books will reference this paper. So it's important that we just quickly talk about it. Sorry for those of you that are horsey. I hope you can transfer all of this over from dogs and humans, but it tends to be that that's where most of the research is. It's all the same, small or large really, but the only difference being the depth of penetration and whether we can get there. So this was a very small study. It wasn't blinded, and it wasn't a particularly high quality study, but it did show positive results. And this did also support an increase in muscle mass as well. So I think that muscle mass part of the puzzle is really quite important. I'll pop that in the vault if you want to read that one. Just finally moving on to, we're clutching at straws here for what we have for literature as usual on animals, but we do have this quite interesting paper by David Levine and Daryl Millis, and this is quite a nice paper to read. I'll pop this in the vault and you can have a look at this as well. So this is talking about tissue extensibility, and what they did was use ultrasound to improve the range of movement. And they did this to the calcaneal tendons, and they heated. So the theory is they heated them with ultrasound, and then the range of movement improved. Now, although this isn't directly looking at osteoarthritis or a joint problem, I think it's quite interesting, because where we were just talking about the joint capsule, it's the same sort of thing. You know, can we increase that extensibility with that? Whether this is to do with heating, or, as we've discussed before, when we've discussed this in previous lessons, whether this is actually to do with heating, making the tissues more elastic, or whether it's to do with, you know, a reduction in pain and an increased tolerance to stretch, we don't really know. But what we can see by this study is there was a positive result. And like I say, I've popped it in the vault and you can read that, but they were able to improve range of movement of the tarsus with using ultrasound. But what they did say, which was very important, and this is also backed up in other studies, human studies, is that the window of stretching is very short. So if you want to use ultrasound or heat or anything to increase range of movement, so the theory would be that you use heat and then you stretch, or you heat and stretch together. It is supported in the literature that heat and stretch together is better than stretching on its own. So if you wanted to use it for that, you only have a short window, and they suggest in this that it's 3 minutes. Within 3 minutes, the changes in extensibility had gone back to baseline. So as far as the technique is concerned, you either need to use ultrasound at the same time that you are doing range of movement or stretching, or you need to use ultrasound and then do the stretching immediately after. Now, there are, you will maybe see videos or people using this synergistic technique, if you like, where they are doing the ultrasound and doing the range of movement at the same time. And I just find with animals, it's very difficult. It's like patting your head and rubbing your belly. It's very difficult to get that going with all animals, because they wriggle and they move, and if you lose concentration and you end up not moving the head, I think that's not a good idea. With a human, you can say, well, I'm going to do the ultrasound and I want you to move the limb, or, you know, it's easier to get them to work with you on it than it is with animals. So I find that a reasonable. And with horses, you know, if you're doing a carpus on a horse and trying to do the carpus and move the limb, it's just you know, not practical. So I would rather do the treatment and immediately after do the movement. But obviously that's down to you if you want to try that technique. But I would just be very wary of not getting distracted and not end up not moving the head, the transducer head. So I think best practice is to do it and then stretch immediately after, or do whatever movement you want to immediately after. This study did show that there was an improvement in range of movement, but it was very small. And then I think, again, we have to come back to, well, what are we trying to do here? Just because we can do something doesn't mean that it's an effective thing to do, an effective therapy. So if we can only improve the range of movement by a very small degree, and for a very short time, is it worth doing it at all? And that's something I think we need to consider. What we're gaining from that. So it's always worth thinking about that. And obviously, you know, all of you guys are therapists or have that sort of therapy background. So I'll leave that to your clinical judgment to decide, you know, what you want to get out of range of movement exercises. But really sort of what are we trying to achieve there? And again, if the animal is coming into you for treatment, how often are you able to do this? How much benefit are you going to get by seeing an animal once a week and changing its range of movement by a very small degree for 3 minutes? Would it be best to advise the owner to use heat at home and do range of movement exercises, or heat before some exercise? You know, obviously weight bearing is going to also stretch those tissues and mobilize them. So would it be more useful? And that's something that we don't have an answer to that, but I think that comes down to your clinical judgment. Personally, I would use it for if we got scar tissue restrictions around, just because of the collagen alignment, and I know that I can get some improvement in there. So I wouldn't rule it out, but I wouldn't sort of use it as my only option. It's got to be part of a multimodal approach, I think. So just in summary then, ultrasound, therapeutic ultrasound is good for osteoarthritis. I think we can say if we can reach the joint, then we should use it. I think it's a beneficial treatment. But what we need to think about is that treatment long term. And I think a better approach than just doing treatments when they, sort of a course of treatment, would be to do a regular treatment with the animal to help with that long-term approach rather than just improve it in the short term. Although what I was saying before about my theories behind exercise and movement with animals, I think if we can sometimes if we can do a short-term treatment just to improve their confidence and get them moving again, then we can carry that on with exercise. Obviously, if the pain returns, then we're going to need to do something to help with the pain, then to help with the exercise. But the exercise in itself actually will have an analgesic effect and will help with the pain. So I think there is a theory that we can use something like ultrasound, a short burst of ultrasound, to get everything moving again, and so that we can just get the wheels turning and kickstart the process. And then we follow that through with exercise. And I think that's a very good approach, because it's not necessarily practical to say to somebody, you need to come to me 5 days a week for forever. That's not practical. So I think that's a very good way to get over that. But you need to then, carry that through with exercise. A lot of the studies actually show, those 2 studies that we've looked at there, that they're treating these cases every day or 5 days a week. So you have to question, if somebody's only coming to you once a week for a treatment and you're doing ultrasound, how much are you doing? Now, I still think it's worth doing that, because you're still going to get a beneficial effect from every ultrasound treatment that you deliver, providing you get the dose right and you can get to the structure. So it's definitely worth doing once a week. But for those of you maybe that have animals in with you, if you're a nurse and you have them in the practice, or maybe if you're an equine rehab therapist and you have horses in for rehab, or you drive past their yard every day, it would be worth doing a daily treatment. You'd probably get a better result from doing a daily treatment, even if that's only over 2 weeks, to kickstart the process. So it's really having a good think about ultrasound. Now you know what it can do. Having a really good sit down and reflect on your practice and think about where you could fit this into your practice, how it would really work in real life with your animals and your practice, and how you can include it as part of your treatment for osteoarthritis.